This vaccine helps to prevent certain serious bacterial infections such as meningitis and meningococcemia. These infections can lead to severe problems such as hearing loss, brain and nerve problems, paralysis, blindness, seizures, and even loss of limbs, even with antibiotic treatment. The vaccine works by increasing the body's natural defense against the bacteria that cause meningococcal disease. Vaccination is the best way to prevent infection, but it may not fully protect everyone who receives it. The brand and dose of vaccine you receive depend on your age. Other vaccines may also be given at the same time, usually in a different site on the body. It is important to follow the recommended dosage and schedule for this vaccine to ensure the best protection. Before receiving the vaccine, make sure to read all the information provided by your healthcare professional. This vaccine is administered by injection into a muscle by a healthcare professional. Adults and children typically receive the injection in the upper arm, while infants receive it in the upper thigh. Depending on your age, the vaccine may be given one or more times. It's best to consult your healthcare professional for your recommended vaccine schedule. After vaccination, fever may commonly occur, especially in infants and children. In such cases, your healthcare professional may recommend a fever/pain relief medication, such as acetaminophen. Be sure to ask for more details if needed. Some common side effects of this vaccine include pain, redness, or swelling at the injection site, headache, fever, chills, drowsiness, tiredness, joint or muscle pain, nausea, loss of appetite, or diarrhea. If any of these effects persist or worsen, it's important to contact your healthcare professional. Rarely, some people may experience symptoms such as fainting, dizziness, vision changes, or ringing in the ears immediately after receiving the vaccine. If you experience any of these symptoms, it's important to seek medical attention right away. Sitting or lying down may help, as these symptoms typically don't last long. It's important to remember that this medication has been prescribed because the benefit to you is greater than the risk of side effects. Many people who use this vaccine do not experience serious side effects. However, it's important to contact your healthcare professional immediately if you experience any serious side effects, including numbness or tingling and muscle weakness. In the rare event of a serious allergic reaction, seek medical help right away if you notice symptoms such as rash, itching or swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your healthcare professional if you notice any other effects not listed. It's also important to seek medical advice about side effects from your healthcare professional. In the US, you may report side effects to the Vaccine Adverse Event Reporting System, VAERS, at 1-800-822-7967, and in Canada, you may call the Vaccine Safety Section at Public Health Agency of Canada at 1-866-844-0018. Before getting the Penbraya Menacwy component, PF, 5 mcg/0.5 ml im suspension meningococcal vaccines, serogroups A, C, YW135, let your healthcare provider know if you have any allergies. This vaccine may contain inactive ingredients that could cause allergic reactions. Also, discuss your medical history with your healthcare provider, especially if you have a current fever/illness, certain nerve disease, or immune system disorders. After receiving this vaccine, be cautious as it may make you drowsy. Avoid alcohol or marijuana as they can make you even more drowsy. Do not drive or operate machinery until you can do so safely. Limit alcoholic beverages and talk to your doctor if you are using marijuana. If you are pregnant, this vaccine should only be used if clearly needed. Discuss the risks and benefits with your healthcare provider. It is also uncertain if this vaccine passes into breast milk, so consult your healthcare provider before breastfeeding. It's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. This vaccine may interact with drugs that weaken the immune system, such as cyclosporin, tacrolimus, cancer chemotherapy, and corticosteroids like prednisone. Be sure to keep a list of all the products you use and share it with your healthcare professional. And as always, do not start, stop, or change the dosage of any medicines without your doctor's approval. This meningococcal vaccine helps protect against 4 types of meningococcal disease, A, C, Y, and W135. It is used to help prevent infection caused by these bacteria. This vaccine works by exposing the immune system to a small amount of bacteria or a protein from the bacteria, which causes the body to develop immunity to the disease. This vaccine is typically given to individuals from 2 months of age through 55 years old. It is administered as a single 0.5 ml injection into the muscle. The best time to take this vaccine is as recommended by your healthcare provider. Always follow their instructions for the best results. Make sure to keep track of your vaccine records for both yourself and your children. This will help in avoiding unnecessary revaccinations for your children in the future when they visit their healthcare professionals. This specific vaccine, Penbraya Menacwy component, PF, 5 mcg/0.5 ml im suspension meningococcal vaccines, serogroups A, C, Y, W135, is important for protecting against meningococcal disease caused by serogroups A, C, Y, and W135. It is usually given as a single 0.5 ml injection into the muscle. The optimal timing for this vaccine is when individuals are at risk of exposure to the meningococcal disease, such as before traveling to certain areas or attending college. It is important to follow the recommended dosage and schedule provided by your healthcare professional. Make sure to keep track of the vaccination schedule for you or your child. Ask the healthcare provider about the timing of each dose and mark it on a calendar for easy reference. This will help you remember when to get the next dose. It's important to store this medication in the refrigerator, but do not freeze it. Different brands may have different storage requirements, so make sure to check the product package or ask your pharmacist for specific instructions. Keep all medications out of reach of children and pets. When it comes to discarding this product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly dispose of it when it expires or when it is no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the proper disposal method. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.